Hello and welcome back to another episode of the Pharmacist Diaries podcast. Today we are on episode 4 of a 6-part series about consultant pharmacists and the consultant pharmacist pathway. I'm super excited that I'm here with Anna Hodgkinson today because I get to showcase what it's like to be a consultant pharmacist in primary, intermediate and secondary care healthcare settings. So if you are a pharmacist who's considering this pathway and you don't work in a hospital setting, then this is the perfect episode for you. Anna is a consultant pharmacist in diabetes, so we're going to hear all about her journey. So let's just introduce her to the podcast. Hello.
Hi, nice to meet you.
Yeah, so happy to have you here and really excited. This is the first time we've met.
Yeah.
And excited to hear about your pharmacy journey. So tell us a little bit about why you became a pharmacist and then your journey into the consultant pathway.
So I can tell you a little bit about my history. So why pharmacy? I used to work in a pharmacy as a Saturday job and got interested in pharmacy from there. I met a great pre-reg pharmacist while I was doing my Saturday job, really inspired me, and then decided to do pharmacy. Came out of university, did my pre-reg in community pharmacy and worked in community pharmacy for about 18 months, but then decided actually that maybe wasn't the route for me. I'd started doing my clinical diploma, so there was other opportunities there, and I applied and successfully got a role within, it was a primary care trust back then, and worked in GP practices and also did some project work within the PCT as well. So I stayed within GP practices working with quite a few different GP practices, looking at some medicines optimization then was given some opportunities to work in some service redesign work around rheumatology pathways and medicines. And that really opened my eyes to different ways that pharmacists could work as well. I did my prescribing when I was there. And then I decided to change roles slightly, and I came across to South East London, where I've been working since. Interestingly, I came across as a heart failure pharmacist. So I was working in the community with practices, but linking in with the hospitals as well. So did clinics for heart failure. Did that for about 18 months, 2 years. There were some opportunities within the medicines optimization team, and moved across to Lambeth CCG as it was. Within Lambeth CCG, I was one of the medicines optimization pharmacists and got, again, opportunity to work in service redesign. So I had a year out as service redesign manager for Lambeth, working on redesigning long-term conditions pathways, working with all the stakeholders, local stakeholders, as well as thinking about where the medicines sat, but the whole aspect of service redesign. That was a maternity leave post, so I went back into the medicines team, and we then took over some long-term condition pathway redesign work as part of the medicines optimization team. From there, I think it was my boss, Vanessa Burgess, said to me, actually, Anna, I think diabetes is a way to go, and there's going to be lots coming around diabetes. Have you thought about specialising? And she was really the first person to talk to me about consultant pharmacist journey. And I had other colleagues, Helen Williams and Lely Obo, who were consultant pharmacists, but within kind of an integrated role as well. Started working in diabetes. I used to work 9-day fortnights and used to go sometimes to clinic on my day off. I know that sounds slightly random, but I just wanted some experience really and to look at whether or not diabetes was for me. Then started my MSc in diabetes and completed that. And in the meantime, I worked with Diabetes Modernisation Initiative, which was an improvement project in Lambeth and Southwark, working with Guy's and St Thomas's Hospital and King's College Hospital, and worked for South London Health Innovation Network as well as one of their clinical leads. So kind of came out of my master's, which was challenging, doing my master's while working full time, as most people know who've done that. And then the consultant post came up. I applied and was successful in getting it.
Okay, that is a whirlwind journey.
Yeah.
But really interesting things happening there. Like you've worked across so many different sectors and seen what medicines optimization is like. from a variety of kind of specialist areas, but also the variety of sectors. And because you've been a pharmacist for so long, you talk about PCT land, CCGs, but all the kind of terminologies are starting to shift. You're now in an ICB, right?
Yeah, absolutely. Yeah. So my main contract is at South East London ICB.
Hi, I'm Anisha, your pharmacist, and I want to talk to you about a supplement I found called Natraflex by The Naked Pharmacy, and contains the superstar ingredient turmeric. This high-potency turmeric contains 95% curcuminoids, which are the active compound within turmeric. It is so fantastic compared to the 4 to 6% that you find in standard turmeric. This high concentration offers significant benefits for soothing muscles and joints, improving sports performance, and aiding in recovery. You can get a 20% discount off this product using discount code PD20 for a natural supplement that truly works. So I love that you kind of transitioned into lots of different roles. And one of the emerging themes that are coming out of this series is how much education that all of you have done. Every single pharmacist who's come through this series has talked about finishing the diploma, finishing prescribing, and then doing either a master's, or with Jo, she did the NIHR pre-doctoral fellowship as well. So kind of getting to that level of mastery requires you to definitely educate yourself and find other ways to kind of bring in those kind of opportunities, the research element, the leadership, the education to help build that portfolio. So it's really interesting to see how you're all on a similar pathway, even though completely different sectors. But what's really interesting is how you're working outside of kind of a hospital setting for most of your career, and how you've kind of built a consultant pharmacist role working in those areas. So tell me a little bit about, I guess a lot of my listeners or a lot of the people viewing this podcast will think, how can I become a consultant pharmacist outside of the hospital? Because I think there is a semi-structured format for becoming a consultant pharmacist in hospital, or maybe it's more common that people do it so people kind of know the journey. You know, you do your band 6, you do a rotational band 7, you become a specialist, you then become the 8A, you might become the 8B, and then kind of fall into the consultant pathway, or realize, hey, I can do this. I'm at that level now where I can start pursuing it. But I think when you look at community pharmacy, or you look at working in a GP practice, you're not hearing as many stories or as much feedback from people as to how they're doing that journey. So maybe give us some insight into what it's like to be a consultant pharmacist in other sectors.
It's it is slightly different, and as you say, traditionally consultant pharmacists were originally in hospital setting, and I think some of the advice I would give would be to take all opportunities and think about the consultant framework. What kind of competencies do you need to gather? There are opportunities, and you know, I was very lucky that the chief pharmacist of the CCG worked with the chief pharmacist at the hospital, along with our lead consultant and lead GP for diabetes, and actually thought this might be an opportunity here to develop a consultant post. So it's part of kind of the infrastructure behind it, but also as an individual, thinking about actually where might there be a role, what could I do to I suppose further my own career. Sometimes it's sidestepping into different opportunities, but gathering that wider kind of array of experience. It is, I think, mainly just looking for those opportunities. You know, consultant pharmacist, it's not just working within one area or one small geography. It has to be that wider geography. Within the hospital, you've got that often there, you know, encompassing a much wider aspect. Yeah, but I think we need to think about as well the patient pathway. So if you think about the patient journey, patient pathway for any long-term condition or any condition, it doesn't stop when you leave a GP practice and when you come into hospital, or when you discharge from hospital, you still have that long-term condition. So the patient pathway spans right across primary care, intermediate care and secondary care. So actually there is an absolute argument that the consultant pharmacist role should be across that whole patient pathway. we've got two roles. I think one is for improving patient care, but also population health. And we can do that from integrated care teams. We can do that from the ICB. We can do that from primary care, whether that's community pharmacy or other ways. So I think grab those opportunities when they come up.
Yeah, absolutely. And diabetes is a great area of expertise because there are obviously so many patients experiencing it. My husband used to be a health coach for the diabetes prevention program.
Okay.
So it was so interesting to see a patient who's pre-diabetic that gets referred to the program. They have their HbA1c taken and they're borderline, and they go through this 9-month program, which is incredible. The amount of information that they receive is so valuable. Everything from the nutrition side of looking after your health, stress management. They look at movement and incorporating more movement and managing stress and how that all impacts the disease. And when you look at the 9-month kind of results, everybody's HbA1c, I think it's 95% at the time he was working there, the HbA1c went back to normal. So there is a lot of funding going into managing this long-term disease, and there's so many complications that come with it that a pharmacist can have really valuable input. Yeah. So I can imagine that if you are a consultant pharmacist working alongside a GP and you've got this amazing clinical expertise, but you also have leadership experience, you've got the education and training side, you've got potentially research that you're doing, that makes you a really incredible pharmacist right there in primary care, in that setting where people genuinely really need a lot of support to try and combat where they're at with type 2 diabetes, maybe cutting down on the medications that they're using some of the lifestyle changes, or if they're losing weight or if they're eating better, that there may be some adjustments we can make to the types of medications that they use and preventing them from getting to the point where they have complications. But on a national scale, as a consultant pharmacist, I'm sure there's so much that you get involved with in terms of guideline development and pathway development. And a lot of your experience working with service improvement must have really supported you on that journey.
Yeah, absolutely. It's kind of, and I think just going back slightly to the, primary care aspect, or, we've got some fantastic pharmacists working in primary care, in diabetes, in GP practices or elsewhere. And I think, anything that people are doing, we should really write up. I think people think, I'm just doing this as routine, but actually it's really important to share some of that, because you might be doing something completely different to somebody else, but innovative, and actually it's really worth sharing. So, locally we've got pharmacists working in primary care doing, great things, and we need to make sure we're encouraging them to really think about, even if it's just writing it down and maybe not getting it published somewhere, but make sure that we're sharing locally or wider. On the national level, get involved in different types of things, really. So myself and my colleague recently presented at Diabetes UK on some of the new drugs coming for diabetes and obesity. We are obviously feeding back on some national consultation documents at the moment, contributing to national statements. So there's lots of different aspects. And I've got two other consultant pharmacists for diabetes that work in the country as well, Phil Newland-Jones in Southampton and Hannah Bieber in Leeds. And so they're also involved in some of the national work as well.
That's exciting. I mean, on a day-to-day, what's your life like as a pharmacist?
So no day is the same, I'd say. Some days I might be in clinic. I do two types of clinic. One in the community, so I've got a type 2 diabetes and kidney complication clinic. And in the hospital, I do diabetes complication clinic as well. So I might be doing clinic in the morning. By late afternoon, I might be working for the integrated care system and diabetes, ICS-wide diabetes meeting. In the middle, might be writing some London guidance, grabbing lunch on the go, answering patient queries. And then the next day I might be working on, for the ICB, looking at horizon scanning, looking at budget impact models for the new medicines coming, developing guidelines, making sure we've got equitable access for diabetes medicines across South East London. So it's really different every day.
And one day you could be on a podcast.
One day I could be on a podcast. Not very often.
Oh, that's really exciting. It sounds very different to obviously what I've had exposure to as a pharmacist. My background is mainly hospital, so I've followed that quite traditional pathway. I've had lots of experience outside in other countries. Like I've been very fortunate to live in Abu Dhabi for a few years and work in different roles. So that's it's really brought different skill set, different experience to my I guess my career portfolio. Which has been really nice. And the last few years I've transitioned to pediatrics and education. And when you look at being a specialist pharmacist, like from my point of view, I worked in pediatric palliative care. You're right that when you look at a consultant pharmacist role, it should actually be across all the settings. And you've made me think about something different today, because when I was managing our palliative care patients, majority of them are actually in the community and at home. Majority of them are with their families or their carers, and they get home visits and home support from us. It's only when they kind of have wobbles in the community that they might get admitted, or if they genuinely are at end of life, they would get potentially admitted or go to the hospice, where we provide kind of more support. But there is lots of support that we can give. But there were so many moments in that role where I felt it was really valuable for me to help educate GPs, as an example, because they don't get exposure to these types of patients very often. So when it comes to service improvement and looking at the role and developing it, a lot of it came down to looking at how are we integrating with the other side. We might be doing our job really, really well, but there's no point doing it if your patient gets home and then can't get access to the medications, or the GP's not comfortable prescribing them, or they're all specials and they're really challenging to get hold of, or there's supply issues and the community pharmacies don't know what to do with it. So there was that piece of kind of speaking to GPs, and we were finding out that maybe each GP might only see one pediatric palliative care patient in their entire career. So they do actually need that support, but engaging with them was challenging because they would choose in their lunchtime to attend a webinar which focused on 20% of their kind of patient population. So they would love the cardiology or the diabetes kind of conversations. But I think from our point of view, the impact of understanding how to manage a palliative care patient at home, who may be with you for months or years, is really important because of the risk factors associated with some of the prescriptions and the unlicensed medicines, the tiny doses, etc. But I also did some community pharmacy shifts. I actually stepped back into the community pharmacy when I was pregnant because I wanted to see what it actually felt like from their perspective, because we face so many issues with our symptom management plans and community pharmacies dispensing things that were complete errors. And it wasn't their fault, but there weren't safety kind of mechanisms in place for them to look at doses. They didn't know where to find guidelines. And then we kind of changed our practices so that we could integrate with them, make contact with them at the point the patient gets discharged, and go through the entire list. So it was very time consuming, but I can see your point. You need to be a specialist across all areas, understand all areas as well. So it's really interesting that you kind of bring that piece into this series, because it's very different to obviously some of the other journeys that we're seeing in this in the context of the 6-part series. And it's really nice to meet a pharmacist who has really explored what a pathway is like in terms of getting to that mastery level outside of hospital practice, because I haven't met that many pharmacists. So I'm very fortunate to interview you, Anna. What the other thing I wanted to talk about was, what challenges have you faced? So for me, one of the challenges was in my role, and though not a consultant pharmacist role, but was integrating in all of those sectors, like dealing with the families in the community pharmacy themselves, the GPs. What challenges have you faced working across all areas?
I think there's been a few challenges. I'm very lucky that I've worked in the area for some time, so I know quite a lot of the teams that I'd work with, and that makes life easier, definitely, and having a bit of experience in the different sectors. I suppose kind of some challenges of the job, but challenges outside of that as well. I think, we've come a long way as consultant pharmacists. I think we've been around about 20 years maybe. But it's still, lots of people still don't know what consultant pharmacists are. And although most do. I've had to explain what consultant pharmacist is, a number of times, and making sure that people understand what the role is, what the role isn't. But for me, it comes down to we're all wanting the same thing. We're wanting better outcomes for patients, and we're all there to improve patient care overall. So I think consultant pharmacists should have a seat around the table with everybody else, recognising everybody's strengths, and no one person can do everything. So, and that's the beauty of an MDT is we can work together to get those better outcomes. I suppose an integrated role, there have been some challenges working for 3 different organisations. When I first started, now it's 2. When I carry around 2 laptops, 2 chargers, 2 everything, there's some challenges with IT. When you try and get certain things sorted, my role's unusual. People don't necessarily understand that I've got 2 hats, 3 hats. And my boss and I joke that we should write a book on kind of how to do an integrated role, or how not to do an integrated role. I've got 3 managers, which can, could be seen as challenging, but actually we work well together. And if there's any issues or we need things sorted out, we get together all together. And it's really lucky. I'm really lucky that we work things out together. And generally their vision is the same. I suppose I have come against challenges, but not necessarily. I think they've been eased by the communication, the relationships that have been built, and we're slowly getting there, or getting there fast, maybe.
Yeah, I mean, again, that's another theme that's come out of this series, is that everyone's journey into becoming a consultant pharmacist has been really different. Not just in the kind of ups and downs of getting that portfolio done and getting all the experience that you need and kind of proving your kind of worth within the sector of practice that you're working in, but also in terms of the duration as to how long it takes you to get there.
Yeah.
You've got to be patient. We've talked about the long game in previous episodes, that this is a long journey. It doesn't just take, from what I've been hearing is that it takes about a year and a half or 2 years to complete the portfolio. But when you look at your role and the level of mastery that you have within that specialist area, a lot of pharmacists are talking about having worked within it for up to a decade before even starting the kind of portfolio. But it's really good to raise awareness of the different sectors and the fact that you can pursue pathways in the different sectors in the healthcare setting and through the NHS. But also encouraging people to think about this early on in their career so they can have a strategy as to how they get to that point. You might not necessarily know exactly which area of expertise that you're going into as a junior pharmacist working in a GP practice, because you might be covering lots of different kind of types of patients, diseases and medications. But it's actually exploring the skills that you need and making sure that you understand what you need to do to get to that point and building on those. So looking at the education pathway, looking at how much research you can do and where you can get involved, say in a primary care setting or a community pharmacy. Do you have to sign up to a master's or a diploma to kind of support you in that journey, to give you that experience and that expertise to then utilize it in that practice setting? Sometimes that's what you have to do. Like for me, I've stepped into pediatrics by chance, but I've also stepped into palliative care by chance because the opportunity was there, and I'm building the role as I'm going. But I know that I've gotten to the point now where if I want to develop that mastery level clinical expertise, that I would like to sign up to either a diploma or an MSc in pediatric palliative care to really just kind of guide me on the journey, but also figure out within palliative care, what is my little niche that I want to be focusing in on? And where does that sit with the rest of the MDT? Because some of our nurses are prescribers, so we don't all want to be practicing in the same areas. So it's really nice to kind of see your journey. I'd like to know from you what you think. How do you think the role is going to evolve as time goes by, or what would you like to see in the future for consultant pharmacists in other kind of healthcare settings except the hospital?
I think, think about the 4 pillars of consultant pharmacy. We've got the education, the research, the clinical side, the leadership. There are just so many opportunities for pharmacists. And whether that's in secondary care alone, whether that's as an integrated role, we could have 5, 6, 7 different consultant pharmacists in the same area, but working slightly different. And that's okay because there's so many opportunities there. I think for me, I'd like to see more integrated roles, as well as the hospital kind of traditional role. I think there are a lot of people that are credentialed, but no posts. There are, and I know the journey is challenging. I'd say don't give up. It does take time. But I think I'd like to see more integrated posts, looking at population health management as well as actually, individual patient care. I think we've come a long way, but we've still got a long way to go. And hopefully with that long way to go, we can do in a shorter period than where we've come from.
I want to talk to you about a supplement I found called Natraflex by The Naked Pharmacy. Each capsule is combined with marine magnesium to support nerve function and bioactive piperine that comes from black pepper to enhance absorption by a whopping 2,000%. This turmeric can help reduce inflammation, support joint health, and improve your digestion. It's a natural way to keep your body in balance. You can get a 20% discount off this product using discount code PD20 for a natural supplement that truly works. Yeah, absolutely. And 20 years is not actually a really long time when you look at it. It's the start of a journey which is going to be really exciting for this profession. We've seen, nurses transition into such exciting roles, like even, 20, 30 years ago when they first started becoming, nurse practitioners and prescribers, supplementary prescribers. That was really exciting for them. And pharmacy is really evolving at quite a fast pace. So it will be really exciting to see more pharmacists go into this level of mastery. And as we get more pharmacists into it, I think the role will evolve because we'll start experiencing new things and innovation will come into it. There's a lot of AI. The digital side of pharmacy is transforming. I mean, literally anything can happen.
I suppose we've got, there's within diabetes, but renal and cardiovascular, a lot of cardiovascular metabolic renal posts are starting to come through. And I can see definitely consultant pharmacist in the future being that multi-morbidity or multi-long-term condition even posts. And I think that's really exciting too, that we move away from kind of single specialty into multi-specialty as well. And pharmacists are ideally placed to do that. We're the experts in drugs, medicines. So I think that's a definite role for us in the future as well.
Amazing. So thank you so much for spending some time with me and sharing your journey into pharmacy and also sharing an area of expertise that we've not necessarily showcased on this podcast and through this series. Thank you guys for tuning in to this week's episode. This is episode 4 of our Consultant Pharmacist series. And look out for episode 5 in the next few days.